Hi, my name is Tessney Davis, and I'm a social worker with Tuscaloosa City Schools. I'm here today to talk with you about discussing the COVID-19 pandemic with your children. I know that we're all a little bit uncomfortable with talking to children sometimes, especially topics surrounding illness or traumatic events. So I hope the tips that I give you today will help you feel more comfortable talking with your children about COVID-19. In this short webinar, we're going to discuss a lot of information, and I will make sure to put links on the TCS website so you can go back and review that information at your leisure after the webinar is over. A lot of the information will be coming from the National Association of School Social Workers, as well as the National Association of School Psychologists. As we begin, I think it's important to remember that children often look to adults for guidance in navigating stressful situations. So we want to make sure we're modeling behavior and emotions in front of our children that will help them navigate their own behavior and emotions. As we begin, I'm going to be giving you some helpful tips and suggestions. They're based on age-appropriate practice for different age groups. So hopefully you'll find information in this webinar that will help you if you have a child all the way from preschool up to high school age. So let's get started. First of all, in talking with children about COVID-19, we want to stay calm, offer reassurance, and listen attentively. That last part can be hard sometimes because we're so inundated with other things that vie for our attention. So I want to encourage you, whatever time you are able to talk with your child about what's going on and the stressors that they're feeling because of COVID-19, make sure that you give them your undivided attention. Turn off the TV, put down the phone, make sure that you're looking them in the eye and it's good one-on-one time. You want to be a role model for your child. Like I said earlier, staying calm is very important. So as you're talking with them, keep your own emotions in check and make sure that you're approaching things and you've handled your own stress going into the situation. You also want to be aware of how you talk about COVID-19 in front of your child. A lot of times it's very easy for us, especially right now when we're isolated, we're under stay-at-home orders, and we are home a lot more than we typically are, and we're in close quarters with people a lot. It's easy to let down your guard and start to talk about things in front of your children that you might not normally talk about in front of them. So just a gentle reminder that it's very important that we are aware of how we're talking about COVID-19 in front of our children. You want to explain things to them that they may be hearing or they may be asked to practice. A lot of times we just assume children understand when we say things like social distancing or we talk about protective gear. We assume that they know what we're talking about. However, a lot of times children don't have a framework in which to place those things. So make sure that you explain the concept of social distancing to them, things like personal protective equipment that they may see when they're in their communities eventually. And then also things like hand washing and proper sanitation, taking precautions like not touching their face, just helping them to understand the things that we discuss a lot of times and take for granted, that they don't understand why or what those things are for. It's important that they have that understanding so it's not scary to them. It actually helps them to feel more in control of their environment and more in control of their own personal health and safety if they understand why we're doing certain practices right now. We also want to make sure we're focusing on the positives, and there are a lot of positives going on in our world right now. Focus on good news stories, uplifting stories. Also focus on the fact that this is not going to last forever, and we will be together again. We will be back in schools. We will be back with our families, eventually extended family maybe that we're not getting to see on a regular basis. They will see their friends again. So make sure you're giving them that reassurance on a daily basis. They need to hear it over and over and over again that this is not forever. They may start to question that as the days start to string together more. Time is a very difficult concept, especially for younger children to understand. So we want to make sure that although we may not know exactly when we will go back to a somewhat more normal way of life, that we are reassuring them that it will go back to more of what they have known in the past. We also want to make sure we're establishing a daily routine. And again, that is going to give them reassurance. So our daily routine might look something like we have a normal wake up time where we wake up, we eat breakfast, we brush our teeth, we do our hygiene routine, and then we do schoolwork, or we read, or we play outside. And then we also have regular scheduled meal times and predictability about what's going to be coming from day to day. So one thing that I have done is I have developed a schedule and put it on a whiteboard in our pantry area where I'm certain that my 13-year-old boys will be visiting often, and they can see our daily schedule and know what's expected and know what's coming. I also think it's very important during this time to help kids identify ways to help others. It helps them to continue to be connected to their community, and it helps them to feel like they're able to be a part of making a positive difference. Some suggestions might be writing letters to first responders, healthcare workers, reaching out to their teachers, friends, maybe even having a pen pal or developing a relationship with a neighbor where they are maybe writing a letter to their neighbor or delivering some little happy note or little happy gift to them. Of course, practicing social distancing, a drop-off kind of situation, but just anything that can help them feel connected to the community around them. And then also during this time, it's very important that we offer them a lot of extra love and affection. Children are used to having friendships, high fives, fist bumps. They may get hugs at school or high fives or lots of social interaction that they're not getting right now. So we want to make sure that that bucket is getting filled at home. They may also be seeking that physical touch or affection or actions that demonstrate love to them a little bit more than normal, and that's okay. We just want to make sure that we're providing that reassurance for them. The second thing I want to talk about is monitoring TV viewing and social media. This is especially important for our middle school students as they are in a transitional time where they may not understand the difference in fantasy and reality, in misinformation and trustworthy information. So we want to make sure that we're really limiting for all of our kids time that they spend watching TV. We want to turn off the news, and that's important for us as parents and caregivers too, because the constant barrage of media can actually damage our social emotional wellness as well. And Like we discussed earlier, children model what they see. So make sure that you're limiting that TV time for you and your child, that you're really making good choices about what you allow to go in to their ears and for them to see and hear, even in the car, on the TV. We want to make sure that we're really staying on top of what they're taking in as far as information. And then social media, of course, we know that social media can help older teenagers. It can help us as parents sometimes feel connected to the outside world. However, it can also be a place that's fraught with misinformation, with negativity, with scary news articles. And so we want to make sure we're limiting that and providing an open avenue if your kids have read or obtained some misinformation, that you're correcting that misinformation. We want to dispel rumors. Rumors are rampant right now. And there's lots of websites that you can get really good factual information to share with your kids. The one that I would suggest right now is the Centers for Disease Control, and that's www.cdc.gov. Their information about COVID-19 is updated in real time, and it's a wonderful resource for you to get your information about COVID-19 and for you to decide what information you're going to share with your children. I think it's also important, because we are such a screen-heavy world, to provide our kids with alternative activities. Thankfully, we're having a beautiful spring right now, so it's a great time to get outside, do some physical activity, maybe teach them a skill. At my house, my husband has been working on some woodworking projects with my son. We're calling it his shop class, and he's getting some real life experience with building things, using some tools and getting some skills in how to create things and use his hands to make something. We also have games and puzzles, and we set up a cornhole game in our backyard. Anything that gives kids an alternative to just sitting in front of a screen all day is wonderful right now. And it will help them take their mind off of things and develop some positive coping skills. The third thing that I want to suggest is that you make time every single day to talk with your children. This sounds a little harder than it actually is. One-on-one time with your kids can be carved out pretty easily, either first thing in the morning or last thing at night. In my family, we usually have a check-in first thing in the morning. How did you sleep? How are you feeling today? What are you excited about today? What are you a little worried about today? Is there anything that you want to tell me before we get our day started? Things like that. And then before we go to bed every night, I spend time with each of my sons one-on-one. I ask them, what was your high? What was your low? In other words, what was the best thing that happened to you? What was the worst thing that happened to you today? And what would you like to do again? What are things that you really thought, this is a great thing, I want to do this again? Or what things did you not like so much, and this is not something that you enjoyed about today, and you hope that that is not something that is a part of our every single day right now. It opens up the stage for them to be able to talk about their feelings, and that's what we want to do, is just give them those opportunities. I talk with kids every single day in my office at school, and when I talk to kids, I always make sure that I have activities available that they enjoy while we're talking. Kids are much more likely to open up and discuss their feelings if they're engaged in an activity that they really like. Usually it's something like Play-Doh or drawing or coloring or moon sand. Anything that they enjoy. With older kids, it might be that they're is some music in the background. It might be that you're outside throwing a football. It might be that you're painting each other's nails. But just find an activity that the two of you can do together that is face-to-face time, and those conversations will really happen naturally as you're engaging in an activity together. You want to make sure that you let your children's questions guide you, so don't feel like you have to force conversation. When they ask you questions, make sure you answer them honestly, make sure that you answer them with factual information, and make sure that you only give them the information that they're asking for. In other words, you don't need to give them every single scenario about what could happen if COVID-19 infects somebody that they know. You don't have to give them every single situation that could happen if we have a lot of cases of COVID-19 locally. We are doing everything we can to make sure that they're safe and healthy, and that's what needs to be reiterated to them. We are grown-ups, and our goal and our job is to make sure that children are safe and healthy. So that is what they're looking for, is that reassurance. And so we just want to tell them, I'm here to make sure that you're safe and healthy, and I'm here to answer your questions and to talk with you about your feelings about COVID-19. And that way, we're not giving them too much information, but we're making sure that they have enough information to feel like they're in control of their health and safety with your help. You want to be honest and accurate. You want to make sure you correct any misinformation that they may reveal in their talking about their feelings with you. Explain simple safety tips. Again, they just need to know things like proper hand washing. They need to know things like social distancing and why we're staying at home right now. If you cover those simple safety tips, the rest is pretty much going to take care of itself. But if they have additional questions, like I said earlier, you can explain those things factually and correct any misinformation that they may have learned. You also want to stay up to date on facts yourself, because that helps you to give your child correct information and helps you to be able to be honest and accurate in your answers to them. The next thing I want to talk about is keeping your explanations age appropriate. This can be hard because we're adults and we're talking to children, and sometimes we forget what it's like to be a child. So I hope that I can help you to remember some ways that you want to talk to different age groups. First of all, with the pre-K and early elementary age kids, we want to keep our answers brief. We want to give them very simple information, and we want to use terms that they understand. So most early elementary or preschool age students aren't going to understand what you mean if you say personal protective equipment. So you want to say, some people will wear masks, some people will wear gloves. And that is something that they wear to protect their bodies from being infected with the COVID-19 virus. So we want to just make sure that we're just giving them what they're asking for and that it's brief and simple. With upper elementary and lower middle school age kids, you may see them asking a lot more questions. They're just more curious at this age. They're seeking more information about the world around them. That is a good thing, but it also sets them up because they're a little more susceptible to misinformation. So we want to make sure that we're giving them really good, really factual information, and they may be more vocal, and so they may have a lot more questions and be seeking a lot more information. And then with upper, middle, and high school students, You can actually talk to them more like you would be discussing COVID-19 with another adult. It can be discussed a little more in depth, maybe not all the way as you would discuss it with an adult, but you can provide them with information like the CDC website that they can go to, graphs so they can see what you mean when you're talking about flattening the curve. A lot of times that flattening the curve graphic, it makes sense to them. It's very reassuring. But for all children, we want to make sure that we're encouraging them to verbalize their thoughts and feelings no matter what. And when they talk, that we're being a good listener, that we're making good eye contact, that we're giving them our undivided attention, and that we're putting away distractions during that time. Another tip that I want to give you for talking with your kids about COVID-19 is staying in touch with their school. We're here to help you talk with them, and we're here to provide you with resources. So make sure you're reaching out to their teacher, social worker, any of the faculty and staff that your child is connected with, and give them that opportunity to connect with people that they're used to seeing throughout the school year on a daily, at least weekly basis. That will help them to feel connected. It will help reassure them, and it will give them other adults to help them navigate these feelings and emotions that they have. We hope that your child is also engaging in their virtual classrooms, and that they're getting to see some of their friends during those classroom sessions. That will also help alleviate some of their fears and anxiety. Finally, the last tip that I want to discuss is please be sure that you're aware of your child's mental health. We do have some children who are more at risk for mental health difficulties during stressful times. Children who have a history of trauma, abuse, neglect, mental difficulties, social emotional problems, or if they have a medical diagnosis that lends them to increased anxiety surrounding things like infectious disease. We want to pay attention to that. We want to make sure that we are staying in touch with their mental health professionals, with healthcare professionals, with the people who are prescribing them medications possibly, or who are involved in their mental health care. Some things are normal with kids going through stress. So I want to reassure you, if you see some heightened fears or anxieties in your kids, that is very normal. However, there are times when it's appropriate to seek professional help if those reactions are beyond what a typical response would be in kids. Some things that you might watch for in young children, elementary age and preschool age, would be regression. So if they have had a skill in the past and they lose that skill, like daytime wetting themselves or nocturnal enuresis, which is just bedwetting at night. If you see them start sucking their thumb, if you see excessive crying, emotional outburst, clinginess that cannot be reassured, you might want to talk with somebody about your concerns and make sure that your child's mental health needs are being addressed. As far as middle school kids, we want to make sure that they're also not displaying any social, emotional, or behavioral problems during this time. So things that you might look for would be extreme withdrawal, depression, not enjoying things that they've enjoyed in the past, not wanting to talk with friends, spending excessive time alone, things that are changes in appetite or activity level that are abnormal for them. You want to be aware of that. And As far as high schoolers, some of those things are the same, but we also want to watch out for anything that is concerning as far as their appearance, big changes in appearance, big changes in their behavior as far as risk-taking behaviors. And then for all ages, we want to make sure that they're not engaging in any behaviors that concern us as far as suicidal or homicidal ideations. So, to sum everything up that we've discussed, I want to reassure you that we are all in this together and that TCS is here to help your family navigate discussing COVID-19 with your kids. If you have any questions about what we've talked about here today or concerns, please reach out to your school social worker. If you have concerns about your child and you're not sure if you should contact help, please reach out to us. If you don't know how to talk to your child and you need further help, then we are here for you. I want you to all stay safe and healthy, and I miss you all so much and can't wait until we're all together again in our schools with our students face to face. And I look forward to greeting you and your children when we're all back together again. Thank you so much. Please contact us anytime.